Welcome to the Full Fueled Podcast. Welcome to the Full Fueled Podcast. Welcome to the podcast with your host, Matt Tack. With your host, Matt Tack.
Your host, Matt Tack.
Who are you?
I'm Dr. Alfred Alessi.
Dr. Alfred Alessi.
Dr. Alfred Alessi.
They know by now, bro. They know by now.
I'm going to set what the new normal looks like in my life.
You're not limited by your genetics.
You have a superpower that is lifting people up. Dude, you look real.
The only way we're going to get the word out is with you. Live full fueled, live beyond limits, baby.
Let's go.
And we're live with the Full Field Podcast. We're doing something a little different today. We tried it out last week. We're going to have some lives, and then we're going to have some edited version on all of our channels. As always, this is brought to you by your host, Matt Tack.
And your boy, Dr. Alfred Alessi. What's up, man?
And I always want to make the disclaimer that if you're enjoying the content, please share, subscribe, click that bell wherever you choose to listen in. But
You sound like an announcer on a sports game. That was really good.
That's actually what the intention was there. But today we're going to go in a couple different directions, but we're going to talk about some personalized medicine and what that means. And then we're going to tackle a little bit in terms of longevity, maybe some training as you get into maybe your late 20s, 30s, and even 40s and beyond, and what training looks like associated to your fun hobbies that you choose to do. So that's something we'll probably tackle a little bit later on down. We're going to keep it short. We're going to dive right in. Tell us a little bit about personalized medicine there, Dr. Alessi.
Yep.
Hey guys, before you get into it, just wanted to come in here.
We got the producer on.
We got the
Kyle,
producer.
good night.
Live.
Welcome,
Wow.
Kyle. Good night.
Hey guys, thanks a lot. Yeah, just trying to see how this producer mode works in Riverside here.
Our first guest on a live podcast, our producer, Kyle Goodnight. I love it.
Yeah, just sitting here in my car. Wanted to come out here. My wife's actually in getting a colonoscopy. What wonders it is to be 50 years old, guys.
TMI, bro. This is live. We're at Facebook right now.
Well, you know, I'm in the medical field
life.
too, and we've got to be conscious on our
That's
own health
absolutely true.
and do the right things to be preventative. And actually, it's a good segment about what you guys are going to be talking about
Do
today.
that earlier than 50. I agree. Yeah.
No, actually, studies. I've read a few articles, one by Peter Attia, whom I love. But, you know, for men specifically, colon health is just becoming such a trending topic. And he actually recommends 35 to start kind of checking things, not maybe necessarily getting a colonoscopy, but a colonoscopy if it needs to be done, but checking in on the colon by the age of 35. Yep, a lot earlier. Yeah,
I mean,
for
it's
sure.
screening, like with everything. That's what we were just about to talk about, was personalized medicine and how important it is to just be ahead of things, like getting blood work done every 6 months, if not, more often than that. And kind of understanding where your metrics are, because stuff happens now. The stuff that we do now in our 30s and 40s is what settles in as disease later on in life, right? And unfortunately, nobody else talks about that in the medical community. It's just a lot of like, oh, well, here you are, you're old. This is what happens. Take this medicine. So, yeah, it's backwards. But
And that's why I like the holistic approach to medicine. You know, chiropractors in my time, and I've been to plenty of them, they always have that holistic approach. And that's a great way to look into your health, is that holistic way to know the whole body and the whole mind and everything. So appreciate what you guys are doing, and letting you get back to your show here. And I'll talk to you guys later.
Thanks, brother. Appreciate you. And we forgive you for your hat.
Oh, come on
Go
now.
blue, baby.
You know
Go
what?
blue.
Yeah. OH.
Go blue.
Go Bucks always.
Thanks for
Also
coming on, Kyle.
Yeah.
So they tell us a little bit about personalized medicine. It's becoming a trending topic for sure. People are just becoming, we talked about biohacking and various things that you can use as terms of smart drugs, but personalized medicine is a lot more in depth of understanding your body. So dive in a little bit, brother.
yeah, I mean, and my take on it is like, you need to know what's going on in your body, right? I think for so long, everyone has just like outsourced our health to a doctor. And that's just the way it's been. I mean, that's the way I was raised. It was like, oh, you have a problem. Let's go ask the doctor or go see a doctor. and then they just try to give you a solution, but they never educate you on anything. So I've really built that into the way that I educate my patients. They come in with an issue, whether it's pain, whether it's gut irritation, whatever it is. I want to get to the bottom of that, and then I want to educate them on why that's happening based on how they've been living their life, and then how can we now change that to get rid of this problem, right? Versus just, here, take this pill, you have XYZ diagnosis, we'll see you in 6 months. People are just in the dark, and so it comes down to starting with understanding where you are and taking control, really taking responsibility of your health, being your doctor. So you have to be your own doctor before someone else can be your doctor, if that makes sense. And so that comes down to, routine lab work. We've talked about knowing all those biomarkers, things that we look for in hormones, metabolism, digestion, electrolytes, minerals. You can get super detailed with blood work nowadays, which is awesome. And you can do it at home. A lot of my patients come in and I just give them a kit, they take it home, they run the finger prick test, and then they send it out. And it's functional medicine blood work. So, when it comes to personalized, that's the whole thing. It's like, it's personal to you. What is your lifestyle right? Let's take you, for example. Busy entrepreneur, 3 kids who don't like the birthday cake that I bought them. Felt personally attacked by that, by the way. But
why you buy a cake then?
It was a healthy birthday cake. 3 kids, busy lifestyle, right? You got all this stuff going on. Like, managing stress is going to be a very important factor for you and how that affects your life, right? So it's personal to you.
Yeah. Another one, I got a good buddy, came into the clinic, highly inflamed, and he needed obviously some direct attention to some personalized health and functional medicine. And what was prescribed to him was drugs to basically get him through the day, right? So that he could wake up tomorrow and take that same drug. Now, the longevity in that, and they told him from the get-go, is like, yeah, likely, this drug does cause dementia. It's like, dude, is that where I want to go? Like,
now
I'm 45 years old.
Yeah.
Right? I'm 45. Like, is that where I want to head? And so you, obviously, hey, go get some blood work done. We're going to come back. We're going to get a leaky gut panel done. See if you have, where the inflammation is being derived from, and then come up with a game plan associated with that, right? To drive down to that root cause. I think that's huge. Another thing that I do want to, one of the big things that, I've been educated on and dug into a little bit more, but that most people don't know is, a lot of people want to take supplementation, and then it also becomes like the timing of that supplementation. So I found out I am a slow metabolizer, and by your body's rate at which it can break down things and actually use it, mine is a little bit slower. And so by metabolizing slower, right, I supplement with melatonin. If I choose to take melatonin at 8 o'clock at night, it is not going to affect me until way later. And so like the effects are not nearly as good. So I know that I actually probably need to take that like around 4 or 5 in order to get the effects of it going into sleep, maybe around 9:45, 10 o'clock at night. And so many people miss out on that. I was talking to Cole yesterday on that. I was like, blood work is a good thing to know. And then like how you're breaking things down. Are you a fast metabolizer or you're a slow metabolizer?
Yeah. And, there's the basic blood work, obviously, knowing, the simple biomarkers that we talked about. And then you can get a lot more detailed. They have some really cool stuff out there, man. You can check your DNA, your what kind of SMPs you have on your DNA that may cause you to methylate differently, so that you're going to bind and absorb different vitamins, either less effectively or more effectively. That's something I work a lot with patients. It's, kind of where I built a lot of the functional medicine practice on is checking for stuff like that. And, when it comes to, I don't want to say a majority of things, but a lot of it can be traced back to our lifestyle, right? Like we're just constantly bombarded by toxic stuff in the environment, in our lives, that we need to just hit the reset button every now and then. So most of my protocols begin with some kind of a detox phase, which I think that's really important.
Yeah, that I personally agree. I think that, I'm not a big one anymore. This is always the thing I come back to is I guinea pig myself a lot. So I actually appreciate the people that can ultimately like change their mind when associated to different health regimens. And one of the things for me last year was like significant fasting. And I had, a regiment where I did typically about 14 to 16 hours of time restricted eating. And then I had one fast, which like that fast, anything over 18 hours, I think is considered a fast. Am I correct on that?
Depends on who you ask, but
Yeah.
I mean, realistically, yeah.
So I did a 24-hour 1 day a week. But, what I saw that, yeah, there was definitely some reduced inflammation and I was at a caloric deficit. But man, was I losing muscle at a very rapid pace. And so what I do now, which is a little bit different than you, and this is what I think is like cool because you can approach it a little bit differently. But like what I'll do is once a quarter, I'll actually go through that detox. And so I'll do a 7-day detox once a quarter instead of doing any level of really time restricted eating. The only time restricted eating I do is I stop eating after dinner and then I pick up essentially the following morning around 8 a.m. So I get about roughly around, 12 hours in or so, maybe a little bit more. But majority of that is obviously in a sleeping state. But I have changed up my mentality. And the reason why I changed up my mentality is because obviously I lift a lot heavier weights than I did last year. And so I want to make sure I'm going in there as strong as I possibly can be. And then I allocate that time of, okay, I'm going into a restriction for a week. And that seems to ebb and flow a little bit better because I think I'm holding at a weight where my body is more justified for my frame. When I'm over 200 pounds, I think I feel a little bit better. When I'm at that $170, $180, real lean, I can run a lot. I just naturally, maybe it's a confidence thing too. I feel a little bit more confident when I'm a little bit stronger than when I am real light. So that's just one thing that's worked for me. But I think you time restrict eat actually a lot more than I do, right?
Yeah, and I think what you might have done when you were doing that was you probably weren't getting adequate protein, right? I mean, you were fasting
Yeah.
a lot. So
Yeah,
I think you were
100%.
under protein. So like you can definitely fast and still hit the protein requirements that you need for building muscle and not lose muscle. That's 100% been shown.
Yeah,
So
I
it's
agree with
like
that.
the other thing is like people think you have to have the protein shake 30 minutes after your workout or else you miss this window of optimal protein. It's like that's been proven to be wrong as well. That's
Who came
not
up with that?
right.
I think that was
Dude, that was
I honestly,
the
I
protein
think that
companies
came
were
out
like,
of the
get your
biggest
protein right
loser.
away. It was
Huh?
like I think it was a marketing thing from freaking Muscle Milk or something. Like
Really?
they were like, if you get your protein right away, so then everyone's running for a Muscle Milk as soon as they finish their workout.
I do think it's a good on that though. I do think it's a good habit structure.
Good habit stack, yeah.
Yeah.
Yeah. But yeah, I mean, if you eat in a time restricted window where you're eating 8 hours out of the day, and then the other 16 are not eating, then you can get all your protein requirements, your micronutrients, all of that in that time. You're not going to lose the gains that you're getting. If anything, it's actually going to optimize it because you're going to give your gut a break during that detox or that fasting window. I'm sorry. And that's what we were talking about. It's like there's the autophagy benefits to fasting as well. But the biggest thing is just letting your gut take a break from eating all day long. So for me, that's the benefit I feel is like I feel like my digestion's better, like I'm more regular and I don't get like bloating or I don't get any digestive issues ever, dude. Like, I mean, unless I like went somewhere and ate a thing at my mom's house and she made ribs or something and it was heavy, then I'm going to feel a little heavier. But other than that, it's like I'm giving my gut time to work through what I just ate, versus like, I use the analogy with my patients when we're talking about gut health is like a post office. They're trying to process what's in there and they're getting new mail at the same time. And it's like, oh shit, we got this new stuff. How do I get rid of the stuff that I got here? But there's new stuff coming in. What takes precedent, right? And that's kind of how our body works. There's constantly being, fed things. It's going to have to work on all of it. So then you're going to have like almost impaired absorption of that food you had because your body's just trying to get it through now, right? There's limited space. So Although, the small and large intestine are very long, so there's a lot of room in there, but you start filling that thing up, you're going to start feeling pretty backed up as well. So that's what I think is, and that's been shown too, like if you want to get nerdy about like, oh, the studies, what do the studies show? I don't really care too much, but I think everyone has to do what kind of feels right for them. That's the whole concept of like intuitive eating, which we've talked about before, kind of understanding like, oh, I feel a little hungry, like maybe I should eat some food. Or like, man, I don't feel hungry, but it's lunchtime. People think like just because it's lunchtime, I have to eat, but I'm not actually hungry. So then they force themselves to eat. That's where it can kind of get a little, listen to your body. And if taking a break from eating is a good idea, then do it.
Yeah, I think that it's not, I know, for me specifically, but then I know this is like, the guys we coach have the same issues, right? A lot of what catches up to people is what they eat after dinner, right? After dinner. And so like the choices after dinner are more neurological and habit structure of like, this is a habit. I want to go after a carb or a sweet or something. And so I always tend to say like, hey, if you need to pacify yourself with something, like if you just need something in your gut to pacify it, the best thing you can do is get a protein shake in you. Like if it's going to be a couple hours before bed and you're like, man, like I really want something sweet, just if you can switch that up and change that up with a protein shake so that you can satiate your appetite for a period of time before you go to bed. It's just like it's a choice, right? It turns
some
into
of those
that.
yogurts too, like some of those like nicer quality, Greek yogurt, got like 15 grams of protein. Maybe it's got a little fruit in it, so you get a bit of carbs.
You get a little bit of hit. That's
Those
actually
are
what I was
great,
going
man.
for. So like that's where I was going with that comment is you want to get like more mush instead of whole foods, because then like during sleep, it's obviously going to be broken down a lot easier than something that's a whole food source that's going to take a period of time. It's going to be
Right.
going through the digestion cycle. So I always tell them like find mush, like something that is easier broken down like after dinner, because you're going to be in a very static state, obviously, when you're sleeping. Of course, if you can go to bed like relatively hungry, that's the best scenario, where maybe you aren't like completely uncomfortable. You're obviously going to get more optimized sleep. But like usually for me, like I want to go some level of satiation to bed for some reason. And that's again, a neurological thing that like, I
Well, it's hard to go to
I
sleep
tell
when you're
myself.
hungry, right? Like it's
Yeah.
not comfortable. Yeah, I feel the same way. I'll do, like I have a pretty good, like say I'm under protein by the end of the day and I'm like, damn, I need to get some in, but it's late. There's nights, dude, I don't come home until like 8:30, 9 o'clock. And I'm like, shit, I haven't eaten since like 5. I'm going to go to bed now. And, I'll make like a protein shake with like a tablespoon of peanut butter, which has some good fats, which actually kind of helps and gets you into sleep. And then, just some like raw 1% milk and a protein supplement. And now I just pretty much put like, sometimes I'll throw some raw eggs in there too. So you just get like 50 grams of protein before bed. It's all mush stuff, like you said. It's going to be broken down pretty quickly. And I'll do that. There's that thing that bodybuilders do where they like wake up in the middle of the night and will eat like a protein shake or something to like make sure they're keeping that anabolism on. And that's like been proven that like that's not as important. You waking up to like wreck your sleep is like affecting you more than you not getting a protein shake. You know what I mean? But like I used to do that. Like in college, I was like, oh, I gotta get these gains. So I'd wake up in the middle of the night and like drink some casein protein that's like slow digesting. It's so stupid.
And that's a good segue for this episode is brought to you by Alessi Functional Health, located in Tampa, Florida, getting you to a pain-free future.
That. Yeah, man. And that's the whole thing with the personalized medicine we're talking about, man, is, as a doctor, I recommend that people knowing kind of where they are, right? Whatever. Obviously, if you have symptoms or if you have any kind of issue, you have to figure that out. But if you don't, if you're living a healthy life for the most part, you still should get routine blood work done, because there's those underlying things that you can, tweak and get better over time that then will prevent, right? If we're talking about prevention is, more important than trying to fix something down the line. So, that's what I always preach is like, it's easier to fix or get ahead of it now, right? Than to wait till it becomes a full blown leak later.
Yeah. Yeah. And part of, something that we preach on, part of personalized medicine is honestly like building out the roadmap of what that looks like. And medicine is not just oral things that you put into your mouth or injectable things that you put into your body. Medicine is across the board. What we speak on all the time is that fuel you put into your body, but then also what you're doing as far as a movement pattern on a daily basis, to get that insulin resistance and really create that environment. That's part of medicine too. And that's part of the personalized medicine that we're referring to here.
Yeah, like prime example is that, say like an older woman comes in and she's osteoporotic. Studies show that the medications that they give to osteoporotic women for, remineralizing bone and all that stuff are less effective than if that woman were to just strength train 2 days a week. 2 days a week, just strength training, load bearing exercise that's going to put stress on the muscle, on the tendon, and on the bone is going to help to your body to then, it sends a signal to the brain. It's Wolff's Law that says bone will grow based on the demand put on it, right? So yeah, you and I, we're fit young dudes. If we just laid around all day, we're going to have, weakened bone, weakened immunity, all that, because we're not putting a stress on it, telling it to grow. And that's how the body works. So I think stress is something that people put a negative light on, but hormetic stress, which is positive, which goes back to that fasting conversation, it's good for your body, right? It sends a signal that like, hey, this is a little uncomfortable. How do I now adapt and grow and become more resilient?
Yeah, for sure. No, I think that's huge. Give us, as we take away this episode, give us your top 3 personalized medicine. I guess we could call them hacks or personalized medicine approaches in terms of like the importance of stages to living a productive life.
Yeah, I mean, step 1 is, you have to do some kind of diagnostic evaluation, right? I think step 1, even before that, actually would be, like really like getting in tune with yourself. Okay, like like you said, a roadmap. What does my lifestyle look like? Do I exercise at all? What is my diet, right? Getting those lifestyle factors in check. Then, step 2 is always I'm going to recommend some kind of functional medicine blood work, whether that's at-home blood work, whether that's going to your primary doctor. It's better than nothing, right? But they don't tend to look for as comprehensive of detailed stuff as we do. So finding a practitioner that, is in line with kind of what you're looking for and can guide you on that, but somebody who's going to educate you along the way, because I educate all my patients. So I'm like, hey, I'm going to run this blood work and show you what it means, but I want you to understand what we're looking at. That way we can run this again in the future and you can tell me what we're looking at, right? Because like now you're your doctor and you can even do it on your own. And so really like giving people the power, right? So like you get these at-home lab tests, you can do it on your own. You can find out, you can understand your levels. And now how do I do interventions in my life to make this better or to optimize it, right? And then I think the third would be, for personalized medicine is like then fitting all that into what you see for your future, right? Like, do you want to have kids? So like, okay, we got to focus on things that are going to, optimize my fertility, right? If you're a woman, do you not, right? So I think that's probably the biggest thing though, is starting with knowing the baseline levels.
That's good. That's what we're going to take away here. I just want to end, obviously, this episode with our sponsors here. So, number 1, thank you, Nutrition Solutions. We love you. And if you want to go check out Nutrition Solutions, you can put in code FULLFUELED15 and get a 15% discount on your first order. Second one that we want to shout out to is Spread Oak Farms. If you go to Spread Oak Farms right now, your first order is 25% off. You just put the code in and you will get 25% off. The code's directly on their site. So head over there, Spread Oak Farms. They got the best beef in America. And thirdly, and probably most importantly, we got Alessi Functional Health again. If you're in Tampa Bay and you want some premier chiropractic and longevity services, you can come check us out. We over there on MLK and North Boulevard. So we got a growing practice over there. As always, brother, it's been good talking to you. Love you. Appreciate you.
Amen.
And as always, live full field, baby. Live beyond limits.
Welcome to the Full Field Podcast.
I'm going to set what the new normal looks like in my life.
You're not limited by your genetics.
You have a superpower that is lifting people up.
So unfortunately, most businesses aren't going to use the highest quality ingredients.
What's your approach?
He's jacked.
I know he's jacked. That's why I'm asking him.
I don't think he lifts.
It's consistency in everything that we do that really compounds.
Only way we're going to get the word out is with you. Live full fueled, live beyond limits, baby.
Let's go.